in the San Francisco Bay Area, and it's a little chilly, and I've got it's not my chai, but it's my coffee, because I was on call last night and didn't get any sleep. So I need some coffee to power me through today. So, all right. Hope you guys are doing well and you're enjoying this series, which we started earlier this year and planning on continuing. Would love to also hear from you all what topics you want us to talk about. And hopefully you guys are ready with your chai or coffee and ready to have a good discussion today. And we would also love to hear your questions. All right, let's get started. So, hi everybody. Welcome to Chai with Cheruba. And today we are going to be talking about fibroid treatments. Fibroid treatments, and finding the best option for you. The last few lives I've done, even though they've been on different topics, there's been a lot of questions on fibroids. So we decided to just dedicate this month to talking about fibroids and treatment options and answering all your questions. I am the fibroid doc on social media, so I guess it makes sense that people are asking questions about fibroids. So let's get started and discussing, discussing treatments. So, do all fibroids need treatment, or can they shrink on their own? So the answer is not all fibroids need treatment. In fact, many times women don't even know that they have fibroids. Now, they are going to shrink on their own, certainly during menopause, when the ovaries stop producing much estrogen. So they can definitely go down in size. They may not disappear entirely, but they can definitely go down in size. It's unlikely that they will shrink a lot in your premenopausal years. With good diet and lifestyle, you can get some shrinkage. But if you have a 10 centimeter fibroid, it's rare for it to completely, go away, but on its own. But yes, fibroids can come down a little bit, again, especially during your postmenopausal years. And not all fibroids need treatment. You only need to treat it if it is bothersome to you. So if it, causes pain, pressure, frequent urination, bleeding, or interfering with your fertility. Or if you're somebody who is undergoing IVF, maybe you don't have those symptoms, but they still want your fibroids out before they put in the embryo. So those are the reasons why you would actually need to get fibroids treated. Okay, let's see. What are the best non-surgical options for managing fibroids? So when we think about managing fibroids, there are surgical options and non-surgical options. So non-surgical options span a variety of different things, mainly around hormonal treatments. So before I get to that, first and foremost, I tell everybody with fibroids that they should really try to minimize stress and try to eat a healthy, plant-based, nutritious diet filled with whole foods, especially cruciferous vegetables like cauliflower and broccoli. We know from studies that these foods actually help manage fibroids. So this is first and foremost. Our food is our medicine. So that's number one. And then number two, we can move on to hormonal medications. So we have options as simple as birth control pills. We've got progesterone IUD. We've got medications and injections that put you into sort of a perimenopausal state and help shrink fibroids. So these are some of the non-surgical options. And then we've got, one other option that I'll mention that it's not really surgery, but it is a procedure, and that's the uterine artery embolization. So we're not making any cuts in your belly or anything for that, but this is a procedure done by a radiologist, interventional radiologist, and they can actually shoot little particles into your arteries that feed the fibroids, and they can shut down the blood supply for fibroids. So this is another great option. So you should speak with your physician to see which option may be right for you. Okay, so then when is surgery necessary and what are the safest procedures available? So if you're somebody who's already tried non-surgical options, then you may now want to move into surgical options, especially if you are very symptomatic. So if you have pain, pressure, bleeding, or you are trying to get pregnant, there are many surgical options available. There are fibroid uterine artery embolization, which I just mentioned was a procedure. There's also coagulation of the fibroid with a procedure called SSA or Sonata that's done through ultrasound. And so these procedures can literally necrose the material that's inside the fibroid. It's not going to completely take it away, but it will certainly shrink it. So if your symptoms are pain and pressure, then this is a great option for you. And then, of course, the gold standard for fibroid management is a myomectomy or removal of the fibroid. And if you are somebody who is pursuing fertility, this may be the best option for you, especially if you are thinking about IVF or in the process of undergoing IVF. Most fertility doctors want a perfect cavity as possible prior to putting in these embryos. So these are the situations for you to think about when thinking about when you should proceed with surgery. Surgical options are definitely a different type of commitment. You do have to be under anesthesia and you want to find the right surgeon. And so it's not to be taken lightly. But if you never want to think about your fibroids again, surgical options are the best. Okay, again, lifestyle changes, diet or supplements help. We talked about this a little bit. So lifestyle changes definitely can help with fibroid shrinkage and prevention of growth. So cruciferous vegetables, whole plant-based diets, vitamin D supplementation. There's some studies have shown an affiliation. I think vitamin D is great regardless. So I think we should all be taking vitamin D, likely. There's a lot of supplements out there, and I'm a little wary about them because there's no proven data. And a lot of these supplements cost a lot of money. And how do you know, well, which ones should I take? Because if you Google fibroid supplements, there's a ton out there. So I don't really recommend any supplements to my patients. I really talk about, again, a very nutritious diet as the best option. Okay. So different treatments. Let's talk a little bit about fertility in specific. So I did mention the uterine artery embolization. This procedure is not recommended for those who are actively trying to conceive. There are studies being done and to evaluate the safety of this procedure in terms of pregnancy. And I know of patients who did get pregnant after the UAE without a problem, but the whole premise behind the embolization is that it cuts off blood supply to certain parts of the uterus. And so you don't know how a pregnancy is going to fully, take off in that uterus, and is it going to go to term? These are some of the concerns that we have, and so that one I wouldn't recommend as a first line treatment. In my practice, I do recommend surgery as the first line treatment for those who are trying to get pregnant. Now, this is for patients who have fibroids that actually, are impacting the cavity or are huge and they're in the wall. Now, if they're really tiny fibroids or they're outside the uterus, I may not even recommend that you do anything, even if you're trying to get pregnant. But if they are in the way of an embryo implanting, then I do recommend surgery because it is the best treatment. It is a complete treatment that can ensure that this fibroid is gone prior to you, progressing with fertility plans, either on your own or, through IVF. So hopefully that answered that. I would love to take any questions about fibroids and fertility or treatment options. I I know I answer a lot of these on YouTube. So yeah, please ask if anybody has any. Yes, this is a good one. 40% of the time when we operate on women for fibroids, we also find endometriosis. Now, that's a big statistic, 40% of the time. So there are many times when I've gone in as the primary surgery would be a myomectomy, and then we've also seen endometriosis. And endometriosis is tricky because it's not something that can really be diagnosed all the time on MRI or ultrasound or even exam. Laparoscopy is the gold standard. So this is how we diagnose. And of course, if we see it, we also try to remove as much as we can. Endometriosis is a condition that causes a lot of pain, causes cramping, can cause heavy bleeding, can cause women to have painful sex, painful bowel movements, and can just cause overall pelvic discomfort, not just during your period, but pretty much throughout the whole month. And so, um, sometimes it is silent, so you don't have any symptoms, but you still have the disease, and it can definitely impair fertility. It can uh, reduce your chances of getting pregnant spontaneously. So this is something that we want to treat when we see it, and we want to suspect it if you have any symptoms. I think the average woman, it takes them 7 different doctors prior to getting diagnosed with endometriosis. So we definitely want to be thinking about it if you have any of those symptoms. Okay. Any other questions? As far as I know, there's absolutely no correlation between folic acid and fibroid growth. If you are pregnant, folic acid is very important for the formation of the brain structures of the baby. So I definitely would not forego or skip your folic acid, especially in the first trimester. So I would definitely do your folic acid, do your prenatal vitamins that have folic acid, and I would not worry about folic acid making your fibroids bigger. Now, pregnancy and estrogen can make your fibroids bigger. So sometimes we do see pregnant women having fibroids that are then growing as the pregnancy progresses. So there is that, but folic acid should not be an issue. Okay. Any other questions? Do fibroids shrink in perimenopause? Yes, fibroids often shrink in size. They may not completely go away, but yes, they do shrink in size. So for many women who are having bleeding or even pain or pressure, often they'll just wait until menopause if they're close. So if you're 50, and you don't mind waiting a couple years, that's okay. But certainly if you're younger and you're having terrible symptoms, don't wait all the way till menopause to take care of it. But yes, fibroids do shrink in menopause. Okay, 50-year-old with 2 orange-sized fibroids considering hysterectomy. My OB/GYN suggests a course of Lupron. Yeah, so Lupron is a medication that helps shrink fibroids and kind of make the uterus overall a little smaller. And this is because it puts you in this perimenopausal state where it's blocking estrogen. And so it helps bring the uterus down. And a lot of times doctors will recommend this because maybe your uterus is so big that the only way to do the hysterectomy right now is via a big incision, like a C-section incision. But if we can kind of shrink this fibroid and this uterus down a little bit, then perhaps your doctor could attempt it robotically or laparoscopically. So maybe this is why they're suggesting it, and it just helps with surgical complications when it's a little smaller. So this is definitely a technique that we use sometimes. Okay. Those are really good questions. Thanks, everybody, for those questions. We have a couple more minutes, so we'll take a couple questions if anybody has them. Otherwise, follow me at the Fibroid Doc on Instagram and YouTube. At this point, I have a few hundred videos on my YouTube channel about fibroids. If you are in the Bay Area and you have questions about fibroids, you're looking for someone to remove them or give you options and help treat them so you can have a better quality of life, then, definitely come and see us. So we're in Lafayette. My phone number is right there. You can contact us online or give us a call. We're happy to see you. We can usually get patients in within a week. So instead of waiting for months, I know the wait times sometimes are very, very long. That is not the case with our practice. We can see you. I am robotically trained, so I do these surgeries with the latest technology that we have available. And maybe you don't want surgery, but you just want some medical options, or just someone to think through these things with you. I'm happy to do that. And we will see you next time. And have a great Thursday. Hi, Doc. That's my friend, Restful Sleep MD. She's a sleep doctor. So hi, Doc. So yeah, thank you, everybody. Have a great day, and we will see you next time. Bye.